This is just a quick quality assurance video about fat suppression. This is an axial fat sat T2 through the elbow, and you can see from positioning this is at the person's side. And the problem here is you got all this bright signal in the subcutaneous fat. Is that edema or is that bad fat suppression? And similarly in the bones, this is a fat suppressed image. Is this bone marrow edema or is this bad fat suppression? Same thing with all this bright signal. It becomes very confusing. In this case, this is here's how it looks in the coronal plane. There's all this questionable bone marrow edema here and here. This is all probably not real. The real abnormality here is that there's an ulnar collateral ligament tear, but you can see how the fat suppression really makes it difficult to evaluate things. And this is particularly a problem when someone has their elbow at their side and they're out of the center of the magnet. So in this case, when you see this, you should switch to stir imaging, or you should try to shift the patient over if you have a bore that's large enough to do that, or shim the coil. Do whatever you can to limit this artifact. But stir imaging certainly would have been helpful in this case.